Test 1, 2, 3, 4.
Good afternoon. Someone pointed out to me that it's a month this week that we have been doing regular or fairly regular updates, and it's hard to believe it's been that long. We've surpassed 1.4 million cases of COVID-19 around the world and more than 82,000 deaths. Here in Canada, there have been almost 18,000 cases of COVID-19 and 380 deaths. Today in PEI, I'm announcing that there are 2 additional confirmed positive cases of COVID-19, one a male in his 20s and one a female in her 70s. Both cases are related to international travel and both self-isolated upon their return to Prince Edward Island. I spoke to both of them just before this briefing, and Public Health Nursing will be following up with them this afternoon. They are both at home and doing well. Along with these 2 positive test results, since I last spoke to you, we've received 449 negative test results. So in total, we have a total of 24 cases here in PEI, including these 2 new cases, and 17 cases are considered recovered. I think we all are breathing a sigh of relief with these results in many ways, because it, again, currently indicates that there's no widespread community transmission in PEI. But I would say we are doing many things that we should do, but we know it's really extremely important that we continue to do them, that we continue to self-isolate following travel from anywhere. And for those who are not self-isolating, practicing physical distancing and good hand washing, really, really key. We may be doing what we need to do, but we need to continue to do so. We are getting questions about non-medical or cloth masks in public, especially in areas where physical distancing is difficult. I just want to emphasize that cloth masks do not replace the need to practice social distancing or wash your hands and not touch your face. Also, I worry that people may think that wearing a cloth mask may think people themselves who are wearing the mask are protected, but it is something that may protect others around you. And if you do choose to wear a mask, it's important you understand that masks don't replace the public health measures that we talked about. And non-medical mask wearing is an additional precaution that some people may choose to take. We continue to receive reports each day to our 1-800 number regarding those who are not self-isolating, and I thank you for voicing those concerns. Our staff are busy calling those who are self-isolating each day to ensure they are well, following public health measures, and are supported. I ask that during this difficult time, people try to show kindness, compassion, and understanding, and help and offer support if they can. This is a time where we really need to work together and not turn on one another. In just a few days, Easter weekend will be upon us. And this year it will be different. And I know that is hard for everyone, for myself and my family as well. But I do know that when I was asked earlier this week that the Easter Bunny's immune system is good, the Easter Bunny does not have COVID, and after discussion with my team, the Premier, the Easter Bunny has been considered essential. And I put that in for the children who may be listening. I want to remind Islanders that despite the holiday, you should not be visiting people you do not live with. And staying home as much as possible is still so important. With these limitations are also opportunities, whether that be participating in faith-based services online, doing video chats over dinner with your family, a games night in, a walk in your neighborhood with those you live with. I know this may not be ideal, but it is also an opportunity to make some new and unique memories. Today, it's easy to become all-consumed by COVID-19. Every time you turn on the radio, watch television, there it is. And while we need to keep well informed, we also need to make sure we take some time for ourselves. Take care of yourself and your loved ones in new ways, and try to see opportunities beyond the challenges. As I've said before, we are not out of the woods yet. Thank you for listening, PEI, to these messages. And now we need to continue to do what we have been doing. And we will get through this together. Thank you. Et en français, aujourd'hui, j'ai quelques notes. Aujourd'hui, on annonce 2 nouveaux cas de COVID-19 à l'île du Prince-Édouard. Maintenant, on a 24 en total. Et puis, il y a 17 cas qui sont considérés comme rétablis. Nous avons également reçu confirmation de 449 résultats négatifs. Comme l'habitude, c'est très important de continuer l'auto-isolement après les voyages et de pratiquer la distance physique, se laver les mains et autres mesures d'hygiène. Il y a des questions concernant les masques en tissu, surtout les environnements publics où c'est difficile de pratiquer la distance sociale. C'est correct et ça pourrait protéger les autres autour de vous, mais ce n'est pas pour protéger vous-même. Si vous en portez, c'est important de retenir qu'un masque ne remplace pas les mesures de santé comme la distance physique et se laver les mains. Il y a toujours beaucoup d'appels concernant l'auto-isolement et merci de partager vos inquiétudes. Nous sommes dans une situation très délicate dont je vous demande tout de démontrer de la compassion, de la compréhension et surtout de la gentillesse les uns envers les autres. Et soyons solidaires. Et c'est Pâques bientôt et ça sera différent cette année et c'est dur pour moi et ma famille aussi. Si vous n'habitez pas avec la personne, ce n'est pas le temps de rendre visite ou de recevoir. Restez chez vous autant que possible et c'est tellement important. Ça fait plusieurs semaines que nous parlons de COVID-19 et les nouvelles sont partout, à la radio, à la télé, en ligne, partout. Restez à l'affût des dernières nouvelles, mais reposez-vous aussi. Prenez soin de vous, de vos proches, avec des nouvelles façons et faire les choses. Traitez ce temps comme des occasions et non des défis. On est capable. Ça va bien aller. Merci. Turn it over to you, Marion.
And Dr. Morrison. Over the past number of weeks, we've talked a lot about the work our health system staff have done to respond to and prepare for a surge in COVID-19 cases and possible hospitalizations on PEI. Our public health and primary care staff have been working every single day to provide significant testing capability and our cough and fever assessment clinic services. We've created capacity at our hospitals, especially at the Prince County and Queen Elizabeth hospitals, which will treat any hospitalized COVID-19 patients. We've been able to meet and exceed our goals for capacity at these facilities. The reduced inpatient numbers at our hospitals have meant that long-term care facilities and others have stepped up to receive patients from hospital, and this support is significant to provide safe and appropriate environments for these individuals. It's enabled us to provide training of staff and physicians in preparation for COVID-19 hospitalizations and a patient surge in PEI generally. Across Health PEI, there's been a concerted effort to provide the necessary clinical training so that we're not only prepared by having space and equipment, but also the most up-to-date knowledge and skills for our staff and physicians. They've been refreshed and trained on infection control protocols related to COVID-19, and this includes proper use of donning and doffing or putting on and taking off their personal protective equipment safely. They've been practicing simulations for various elements of care for patients, from proper transfer to those more critical care interventions such as intubation and ventilation. They've been sharing information about best practices in all service areas: acute care, long-term care, home-based care, and mental health and addictions. I want to thank our staff and physicians who are stepping up to ensure we are prepared as possible for the weeks and months ahead. The cough and fever clinics and drive-through testing clinics will continue to run 7 days a week in both Charlottetown and Summerside. And just a reminder that appointments for these clinics are on referral from your family physician or a nurse practitioner or through 811. When arriving at the clinics, please remain in your vehicle until you're notified by staff on site to come in. And I want to remind patients who have ongoing health concerns that our other primary care providers, such as your family doctor or nurse practitioner, are still able to see you in person or sometimes through the telephone. Our virtual care platform has had local testing completed, and over the next day or two, these providers will be able to register with the service through our Health PEI rollout. Further information on accessing these services will be coming. Those with chronic conditions still require care, and while we must follow Dr. Morrison's advice and orders, and we appreciate every Islander's effort to do so, we do want to remind you that follow-up care for existing conditions is important, and please call ahead to your care provider to ensure that any appointments are still being offered and are available to you. Thank you once again, and as we go into this long weekend and a holiday weekend for many, I would just reiterate Dr. Morrison's comments of take the time to please continue to stay home and keep our numbers low on PEI so that our health system can manage this. Our staff will be working every day to continue to respond and be available for the care needs of Islanders. But by your staying home and physical distancing, it has helped us cope and manage and be very prepared for what we hope will not come. So thank you.
Thank you. Thank you, Marion. Be a pleasure to take some questions.
Nicole Williams, CBC.
Hi, Dr. Morrison. You mentioned sort of breathing a sigh of relief with these new results. I'm wondering, though, if it means that we're getting closer to projections for PEI, the modeling for PEI cases. Where are we at with that?
So I think it's a really good question. And as you know, some of the other bigger provinces who've had a larger number of cases, Quebec and Alberta releasing some modeling yesterday. So we are actively doing the modeling, and we'll be reviewing some of it this afternoon. So I would anticipate it being very soon. I can't say for sure it'll be tomorrow, but it'll be shortly. And even additional cases and numbers of tests this week will be important. And remember, I think I've said it before, I mean, modeling is a tool, and it's one of many tools that we're using to look at what can happen in this situation and not necessarily what will happen. So we'll be certainly talking more about it when the modeling is released for the province.
Thank you. And I'm also wondering, you sort of mentioned, or you did mention, that this means that at this point there doesn't seem to be any community spread or widespread community spread. Do you know how far off that might be? Is it possible that that's something we could avoid altogether, or do you think community spread is inevitable?
Well, I certainly, community spread continues to, or community transmission continues to be primarily the driver of many of the new cases across the country. And so I've been saying all along, I do anticipate it coming here, and I hope when it does, we're able to really control it. However, having said that, I think we're doing a lot of the things we should do to try to limit that. And that is around the messaging around self-isolation. It's around the messaging when people are arriving at the airport and at the bridge. It's around the media being really good at making sure people understand and get the messages around social distancing. So I think all the things that we are doing here, we need to just continue to do, and that may limit that widespread community transmission that they're seeing in many other places in the country.
Thank you. Steve Bruce, CBC.
Hi there, Dr. Morrison. It seems it's still lagging
Breaking up a little bit.
Oh, can you hear me there?
I can now, I believe.
Okay, sorry, I've been having some phone issues. It seems PEI is still lagging behind most other provinces when it comes to the number of tests per capita. Do you have any sense of why that is? And I guess, does that concern you in any way? Are we doing enough from your perspective?
Well, I actually think when we look at the number of tests per capita per million, which of course means that we're having to multiply our population, it actually is getting better, and it's actually gotten quite a bit better in the last number of days. So I didn't calculate it out with the new test numbers, but we can certainly bring that back tomorrow, because we have been looking at it in relation to the other provinces. Our testing capacity is continuing to increase here. And in terms of our ability to do more local testing, and as you know, we've been looking at testing people with a range of symptoms, because people are presenting with COVID-19 with a range of symptoms, doing that for people who are not just travel related, so people who have traveled, those that haven't traveled, who may have fatigue, chills, sore throat, cough, runny nose. So it is a range, and so we encourage people to continue to get tested so we can really do early identification of cases.
And you talked about the local testing. At this stage, how much of the lab analysis is being done here on PEI? And I guess, why aren't we doing more of that here yet?
So, so the initial local testing capacity came online last Thursday, I believe, and so it was limited over the weekend with only so many tests available, and that was primarily for healthcare workers and maybe someone in community care facilities, sort of high priority in terms of the concern. But and then new tests have arrived, test kits have arrived today or last night for the lab, and so we anticipate being able to at least do 2 or 3 times the amount that we were able to do last weekend in the days ahead. And then by next week, having another machine as well as tests available. So I actually think we're definitely increasing that capacity. Dr. German, our medical microbiologist, has said that he anticipates increasing that capacity, doubling it for sure in the days ahead.
Okay, thanks so much.
Jim Day, The Guardian.
Good afternoon. For Dr. Morrison, what is your best estimate of how many islanders are currently in self-isolation?
Oh, Jim, that's a good question. It would be, I mean, we're talking about the people who have to self-isolate on return from travel, so it would be, I don't have the exact number, but I know we're calling people, certainly 1,000 people. We would be calling who have arrived in the last few days since we instituted the calling every person that is arriving. So there would be at least those numbers, and then people who should have been self-isolating prior to that, plus our cases and their contacts. So it's a really good question, but I'd have to do a little math in my head to try to figure out what that number should be.
Right, and what's being done to monitor their compliance, and how large a role does the public play in that?
So those who are self-isolating, and I'm not sure I mentioned it, but the people who are self-isolating or coming across the bridge or at the airport, and they're arriving by air or car, then they're being given instructions to self-isolate. And then our staff is which a lot of wonderful help to do so, are calling each of those individuals, and then they're asking them, do they understand self-isolation? Are they at home? Do they have the supports they need to self-isolate? If they don't reach them on the second call, they call them once, and if they don't get through, they call again. And then if they can't get through, they're trying to make sure they contact the person who self-isolates. That's all within the day. And if not, then it is sent to enforcement. I'll help follow up. So I think that is one of the ways that PI is trying to make sure there's good follow-up for self-isolation. And I think for some people, they may not realize what self-isolation means, because we've said before, this is new for a lot of people, and self-isolation does not mean that you're going to the grocery store. It means staying in your dwelling and having supports to help. So the community can help support those who are self-isolating, who may need more assistance. So I think the community has a role, and we also have a role in public health. So in both cases.
Thank you.
Thanks. Sean McDougall, Eastern Graphic.
Good afternoon, everyone. Marion Dowling, this question is for yourself. How many healthcare workers in the employ of Health PEI have been mandated to stay here on the island to work for Health PEI during the public health state of emergency, who otherwise would have worked part of the year outside of the province?
Hi, I don't have the answer to that question and the specific number. We had made a decision at the beginning of the outbreak, I guess, before it even was declared a pandemic, to eliminate work-related travel for Health PEI employees. We would have other staff who may travel to work with other employers in other jurisdictions or do other things, but I'm not aware that we have said to our employees that they aren't able to travel, but if they travel internationally, they have to comply with the self-isolation upon return, and so there are implications for that for themselves individually. So I don't have a number for you, but we could find that out if you want to send your question.
Okay, and for those nurses or registered healthcare workers, how are they being compensated while they're being mandated to stay in the province? Are they being given full-time hours to supplement their otherwise income loss, or how does that look?
I guess I'd have to look at what a specific circumstance was. If there are employees, there's certainly lots of work for them, in particular if there are registered nurses. So I don't know if I have a better answer to that question. We have lots of work for our staff. So I think if you have specific questions, we could try and find that information out for you. But the individual circumstances would, and the type of work that they would be doing. And we've also been redeploying staff from specific areas when we've reduced to essential services. So we've reassigned them to other clinical areas to do work that they have the skills and knowledge to do. So we've been using those staff in different areas. So, for example, our staff from primary care services and public health are working in our testing and screening clinics, as well as our the cough and fever assessment clinics. So there's lots of shifting happening, and then the additional training as well. So staff who may have formerly worked within intensive care units or emergency departments are coming back to work in some of those areas, and that when they have maybe moved on to another role within a service area that's moved to reduced or essential services only.
Can I just get you to repeat that last part, Ms. Dowling? I think someone's phone is not on mute, so I couldn't catch that last part.
Sorry, I just was saying that we do have staff who have been previously staff members within some of our critical care areas that are moving back to those areas and receiving training on any new equipment and those types of things. So staff are being redeployed to other areas during this time if they've moved to another role in a different area of our system where their service is no longer being offered during this time of essential services only.
Okay, thank you.
Carrie Wynn McLeod, Ocean 100.
Good afternoon. Ms. Dowling, my first question is for you. You talked about, some long-term care facilities and whether it be community care or nursing care or Alzheimer units. What are the protocols within those facilities for the residents and the workers? Specifically, I'm thinking of meals and that sort of thing. Are they all still eating together? Are they doing the self-distancing at that time? Are they eating perhaps maybe just in the residents' rooms?
Hi, Carrie Wynn. So there is a range depending on the facility and the setup, and so it would be very different for a community care facility than even some of our dementia care units. Or our public facilities and what they have set up. So, of course, this is their home, but I know all of our facilities have been putting plans in place to have their dining rooms for residents set up to allow for physical distancing with the residents, and some others have been able to still provide their meals within their rooms. So it's really a range of what they're doing, but their plans are in place to comply with the public health order to allow for that social distancing, but this is within their home for those individuals. So it's a little bit different than, a public dining room. This is where they live, and of course the visitor restrictions are in place, so people aren't coming in and out of those homes from the public, other than our staff.
Thank you. And I know we've seen in some other provinces where people have had concerns about workers in those facilities working at multiple facilities, perhaps maybe say, at Atlantic Baptist, and then they pick up other shifts at Whisperwood or something like that. Are there any restrictions on the workers here about just working in one spot while the pandemic is happening?
It's something we've been talking a lot about and monitoring and actually trying to understand what the impact would be if there were some rules put in place. We know that we have employees of Health PEI, but also employees of the private facilities who work at multiple locations at times. So we do understand that that is happening. There's been other protocols in place around the staff monitoring themselves in those facilities every day or every shift that they're coming to work, as well as the monitoring of the residents for any symptoms or signs for illness. So we've put those parameters in place, and right now I would say we don't have rules in place to say people are not allowed to work. We do have some guidance out there to let people know that we are looking at that, though, and it will become really important if we are to get any positive cases among any healthcare workers or any of those private or public residences.
Thank you.
Stu Neepy, The Guardian.
Hi, good afternoon. Question to Dr. Morrison. I guess about the local diagnostic testing lab. As of yesterday, it seemed that, the numbers that were coming back, it didn't seem that there were, 30 test results a day or more than that were being processed. So I'm wondering what the explanation is for, I guess, the fewer than expected test results that we're seeing out of this local lab.
Well, I don't think there were fewer than expected results over the last few days from from our local lab, but I think the process of trying to get our lab tests to the National Microbiology Lab had some challenges over the weekend, and that meant that there were more lab tests at the NML for them to process. So it is something I think we will likely see over the days ahead, more local lab tests come back, but also not have that delay over the weekend. And so I think those processes are in place, and so that will mean we have a more consistent number of tests, both locally and with the great assistance of our National Microbiology Lab as well going forward.
Okay, and just as a follow-up, I mean, on Thursday, I guess the expectation that you'd said was about 30 test results a day from the local lab. How many test results have so far been processed from the local lab in Prince Edward Island?
So I can't remember exactly what I said on Thursday, but I think since Thursday were given so many tests to use over the weekend locally, and those tests, because you need to have a certain number of test kits. So those test kits were used, and I think I said Monday we had used close to 50 of those local test kits. So we basically used up many of our local test kits, and then with another 180, I believe, arrived last night, then we'll be able to use those up over the days ahead as well. So that's exactly what was expected from the lab, that capacity in terms of test kits would start small and then increase. So that's what we will be seeing, remembering that it was less than a week ago that we actually got our online testing here in PI, which is great.
Okay, thank you.
Laurent Rigaud, La Voix acadienne.
Oui, bonjour, docteur Morrison. J'avais une question concernant les masques et les consignes que vous avez dit à nouveau tout à l'heure en anglais. Aujourd'hui, on voit que l'Organisation mondiale de la santé et certains pays estiment que quand il s'agira de lever les restrictions et de retourner à une vie normale, l'utilisation massive de masques pourrait être une solution pour éviter un rebond de l'épidémie. Est-ce que, au niveau du Canada, c'est une option qui est envisagée?
OK, je pense que j'ai compris votre question. C'est le sujet des masques qui sont pas les masques médicaux. Et puis, je suis en train de chercher les mots en français, mais ça me perd. Mais on suit ici vraiment, c'est pas vraiment la même chose ici au Canada qu'aux États-Unis. Et puis, on suit vraiment l'évidence, qu'est-ce qu'on sait de comment le virus est transmis. Alors, les masques non médicaux sont vraiment pour peut-être protéger quelqu'un d'autre seulement quand vous ne pouvez pas faire la distance sociale. Alors, peut-être quand vous êtes sur l'autobus, au supermarché, et ça ne vous protège pas vous-même, mais ça peut protéger quelqu'un d'autre si vous ne pouvez pas garder la distance physique. Alors, ça ne remplace pas les autres mesures qu'on a ici au Canada et qu'on connaît à l'île du Prince-Édouard aussi. Alors, on ne suit pas exactement les États-Unis, mais on est en train de les entendre et puis je sais que Dr. Tam est en train de regarder encore à chaque moment l'évidence qu'on suit ici au Canada.
Merci.
François-Pierre Dufault, Radio-Canada.
Bonjour, Dr. Morrison. Je me demandais, pourriez-vous répéter en français comment on évite une situation comme celle d'hier où on se retrouve avec plus de 400 tests pour lesquels on n'avait pas de résultats et là, on reçoit plein de résultats aujourd'hui en bloc. Comment est-ce qu'on évite une situation comme celle-là à l'avenir? Est-ce qu'il y a moyen d'augmenter la capacité d'analyse ici à Lille ou s'il y a d'autres solutions pour éviter qu'on se retrouve comme ça?
OK, alors, bonne question. Alors, pour éviter cette situation, on est en train de augmenter le nombre de tests qu'on peut faire ici à l'île du Prince-Édouard. Et puis, on a reçu les tests, l'équipement pour les tests qu'on peut faire ici, c'est 3 fois plus que le week-end. Alors, on va les utiliser dans les jours qui suivent. Mais aussi, on s'organise pour que même pendant le week-end, les autres tests de l'île du Prince-Édouard pourraient être envoyés au laboratoire à Winnipeg. Pour qu'il n'y en a pas un délai en envoyant les tests. Et puis aussi, on a des offres de nous... on parle aux provinces Nouveau-Brunswick et Nouvelle-Écosse pour voir s'ils peuvent nous aider pendant le fin de semaine. Alors, j'espère et j'ai confiance que ça ne va pas arriver encore.
Vous avez parlé tout à l'heure du sentiment de soulagement que vous avez eu lorsque vous avez constaté ce matin qu'il y avait seulement 2 nouveaux cas sur tout ce nombre de tests qui auraient pu être possibles. Quand on parle de possibilité de transmission communautaire à ce moment-ci, jusqu'à quel point est-ce que c'est un danger réel et immédiat pour l'île du Prince-Édouard, sachant qu'il y a 24 cas et ce sont tous des cas qui sont liés à des voyages à l'étranger?
Je pense que chaque jour, on doit regarder pour essayer d'identifier les cas tout de suite et pour qu'on peut mettre nos bras autour de ces cas s'ils commencent à être ici. J'imagine qu'on va avoir les cas communautaires, mais j'espère que tout ce qu'on fait va réduire le nombre de cas communautaires. Alors, on va faire les tests des personnes avec les symptômes, on va de continuer de parler des mesures et chaque jour, on voit les personnes qui ont les cas, on va les suivre. I'll just, the last couple of questions were in French, and I know I'll try to remember to remember what they were to translate them. One was about about community transmission, and I think I addressed that a bit in English already, that we'll continue to watch for community transmission, that we see it happening in our other provinces, and the important thing is to continue to test and be able to really identify early these cases, but really how important it is to continue to do the measures of self-isolation, social distancing, to reduce the impact of any community transmission. And the other being about how can we make sure that we don't have any sort of block of tests going forward that are outstanding. And I think we are working on making sure that how the lab sends our samples off to the National Microbiology Lab is as smooth as possible, making sure that we increase our testing here, which we know we're doing, and also even working with our neighboring provinces if we need help over the weekend. So I anticipate going forward much that not happening again and working with our laboratory to make sure it doesn't. Thank you very much.